and we'll start right now. Welcome, greetings, and thank you for joining us today, despite Nigeria has a match right now. And it's a pleasure to have all of every one of you in this space. Why this session is ongoing, I'll kindly suggest you share with the share button on the lower section of your device. You'll see the share button there, and let's see if we can have more persons join the discussion for today. Today is Father's Day, and the month of June also serves as a month to drive awareness on men's health. And that's what has brought us here today to see how we can promote healthy lifestyles and improved health and well-being for men, at the same time promote gender equality. I'm Loretta Inofri Laurel, and I'll be moderating this session for today. Today's session theme, men's low life expectancy and gender equality, is brought to us by Girls Power Initiative in collaboration with the Nigerian Association of Resident Doctors. Oftentimes, when we get to hear resident doctors, the first thing that comes to mind is agitation for better work environment and strikes. But actually, the Nigerian Association of Resident Doctors happen to be the power force between most, if not all, of our teaching hospitals and beyond that in our country. So it's an umbrella body for more than 6,000 doctors who strive to improve our health care and bring optimal health to us. Beyond just within working within the health facilities, the association gets to undergo outreaches, just like an educational awareness program, just like what we're having right now. So NAD, in collaboration with Girls Power Initiative Nigeria, which is a feminist institution that has been working since 1994, that is 29 years in the month of July, to promote gender equality through the empowerment of children and young females, has thought it necessary to have this conversation on how men's health can aid in driving gender equality in partnership with the Nigerian Association of Resident Doctors. Today's session is going to go beyond just looking at the health aspect of of men or lives or well-being. Also going to be looking at the social determinants of health. Just as you all who have joined us today and curious about how does men's health and gender equality gets related, I'm also enthusiastic as you to be informed on this topic. And today we are delighted to have two key speakers who are professionals in their fields, who also happen to be doctors, but have taken different paths in the medical profession. We have Dr. Otobong Peters, who is a urologist. Yes, for many of us, we I don't okay, let me not say for many of us. For myself, I got to really know about urology just because of this session, and it was I'm used to gynecology because urology is a doctor with um, with profession in the male reproductive system and male and female urinary tract. So getting to know that, yeah, so beyond just gynecology, we have urology. So it's a learning opportunity for me too. So we have a senior registrar from Urology Division, University of Uyo Teaching Hospital, and is a member of West African College of Surgeons. Welcome, Dr. Peter. Here with us too is Dr. Stephen. Dr. Stephen Oize currently serves as the health advisor at Plan International, where he provides technical and strategic leadership for the organization health interventions that includes the sexual reproductive health and rights, nutrition and water sanitation and hygiene, WASH. Beyond just working in that space, he has held various leadership positions in both humanitarian and development settings. And with that, we will really hope to get insightful discussions on today's topic: men's low life expectancy and gender equality. And more so, according to Girls Power Initiative and the Nigerian Association of Resident Doctors, their primary aim of having this conversation today is to is to encourage healthy lifestyles and well-being of men, and as well to see how this can aid in driving gender equality. Welcome once more, and I wish we all gain as much as we want, and beyond just getting the information, we get to share our knowledge with others. In the meantime, just for some house rules, we have the at the extreme bottom of our device, if you're using a mobile device, at the right hand side, we have the chat button. So we would encourage that if there's that haha moment you get to feel, or that point where you need to share your thoughts or your comments, or you can't wait before speaking, kindly use the chat button. We also encourage that you share. There's a share button just beside it. We share this conversation. Let many persons get to join us and learn from it. Then close to it, we have the smiley with the height, with a heart icon. So at any moment when the speaker is speaking, and however you're feeling at that moment, please let's use the smiley to indicate our reactions. Just like now, I'm using the clap icon. That way, the speaker gets to understand that we are all listening and we're following up with the conversation. So, in line with that, just last of our tip for an engaging session is going to be um, requesting to be a speaker. Thank you, Hamad. Is going to be requesting to be a speaker. So this today's session is going to flow with our speakers giving us insights on today's topic. Thereafter, we're going to be having um, a session whereby the floor will be open for everyone to speak and share their contributions. So, in line with that, when you want to speak, just request to be a speaker and you'll be given the floor. For many persons to be able to contribute into the conversation, we do encourage for us to be concise and brief. And while you are done speaking, please mute yourself using the microphone icon at the extreme left. Thank you, and it's a pleasure having all of you here with us. Once more, I'm Loretta Enofe Laurel, and I'm the host of today's session. So today's theme: men's low life expectancy and gender equality. We'll be having with us Dr. Peters, who is going to be speaking more on men's health and well-being. Dr. Peters, I would like to say when we hear the word life expectancy, what should we be thinking of? Can you give us more insight what life expectancy is, what it means, and why is why is it that at this point in time we're having statistics showing men having lower life expectancy in comparison to women? So could you kindly address this, possibly looking at the life stages of men at different points in their lives? So we understand no man just came out and metamorphosed or came in as a man. At one point, he was a boy and got to an elderly man at some point too. So we understand different life stages could affect this. So we'll give you the floor and we'd like to learn from you. Thank you.
Okay, thank you very much, Loretta, for having me. It's a pleasure to be here. I think okay. So when we talk about life expectancy, it basically
Sorry
means.
for interjecting. Can you please speak a bit louder? Thank you.
Oh, okay. Can you hear me better now? Just to confirm.
Yeah, but
Hello.
if you can tune up your volume. Joking, doing.
Okay,
But if you can speak
I've
louder,
done that.
thank you.
Okay, can you hear me better now? Hello.
Yeah, I can hear you, but it's not so loud.
Loud.
Sorry, Loretta. I think
Okay.
it's probably your speaker that is low because your voice was a bit lower than his. His own is loud here.
Oh, really? Thank you for
Yeah.
that. Possibly it's for my end. Thanks for that.
All right. So thank you very much, everybody. Thank you, Loretta, for having me. Thank you, Girls Power Initiative, for having me. So I'll just highlight on the possible causes of the low life expectancy in men. So when we talk about low life expectancy, that basically means how long do we expect this person to live to survive? You know. So we usually, like for us surgeons, we look at the life expectancy for patients before carrying out major procedures. For those patients, we expect them not to live up to 5 years. Sometimes we deploy the conservative approach in care. So I think I'll be discussing the low life expectancy in men. So as I think it's a common knowledge that there's lower life expectancy in males across all age groups, and this has been established from several expert opinions in the past, as well as some high level evidence from research, several different researches that have been done. So, and it's also important to note that life expectancy varies across countries of the world, and it's actually lower, that we expect people to survive not as long as expected in underdeveloped and developing countries compared to the developed world. So, as we know, Nigeria, of course, is a developing country. So, it's one of the countries with the lowest life expectancy worldwide right now. So currently, according to data from National Center for Health Statistics and CDC in the United States, a retrospective study was done for men and women, like a comparative study, and that was between 1900 and 2003 for ages at birth at 65 years and at 75 years. And then, so following the study, a gender gap was noticed in the mortality pattern, meaning that for age, women lived longer than men. So, and then there were several reasons for that. And then it was also noticed that the this gender gap in these mortality statistics was partially because men actually die at a younger age from things like liver disease, heart disease, homicide, and other conditions. So, but the basic information from this study was that women outlive men. So we are going to look at what are the contributing factors to this gender gap in life expectancy. So, well, several studies have been done, and some leading explanations for this women's advantaged mortality profile were given. Some explanations were given, and then it was actually multifactorial. Some included biological factors. Of course, we know that those ones are non-modifiable. There's really nothing much you can do about those ones. We are going to look at them in details in the course of our discussion. Then other factors that were considered were sociocultural and behavioral patterns in men. Okay, so I think let me start with the biological factors. So from the biological standpoint, several studies were done, and we know that there's a major hormone in women called estrogen, and this study showed that estrogen actually protects women against heart disease by reducing the circulatory levels of harmful cholesterol, as we call those ones low density lipoproteins. And then testosterone, however, increases the levels of these harmful cholesterol. So one other explanation that was given was that women have stronger immunity, partly because of the fact that testosterone causes some form of immunosuppression. Then another explanation that was given, an important point to note, is that the frontal lobe of the brain, that is a part of the brain that is involved where that controls judgment and then involves consideration of the consequences of somebody's action. Okay, that part of the brain, the study has shown that it develops more slowly in boys. So as a result, more boys and men tend to die from accidents and violence related events like drunk driving, and then things like homicide. Okay. So now, some other studies actually showed that men tend to die. The chances that a man would die from heart disease at a younger age is higher than that of women. And then 50% of men are more likely to die from heart disease when compared to women. So another interesting explanation that was given was that the Y chromosome, this basic knowledge that a man is made up of two chromosomes, the X and Y, and then the female is made up of two, the X and the X. So the study showed that a Y chromosome actually tends to develop more mutations. Mutations are basically abnormal changes in cells, okay, than the X chromosome. So the developmental disorders generally are more common in boys. So that actually also reduces the chances of survival. And now, so in to also support this, there is what we call X-linked abnormalities. So now these X-linked abnormalities are usually masked in women because there's a second X chromosome that actually suppresses the effect of the abnormal X. But in men who have XY, the X-linked abnormality is going to manifest. We all know, for example, hemophilia is very common in men. It's actually an X-linked recessive type of inheritance. Actually, there's actually the dominant X-linked dominant pattern of inheritance, which we know that type occurs in males and females. So in this case, we are discussing the recessive type. So in the course of this research, researchers also found out that the biology alone cannot explain this gender difference in mortality. Okay, since there is also relationship across different nations of the world, that means there may be other factors that are also involved in the etiology. So now, most contemporary research, of course, focuses on the social and behavioral factors, attempting to explain the gender gap in mortality. Okay, some of these social, cultural, and behavioral factors include poor health seeking behavior in men when compared to women. There's a higher chance that a woman is more likely to seek medical help, okay, when compared to a man, assuming they're having similar or same ailments. So one other factor that was considered was alcohol. Of course, we know that men are more likely to drink more alcohol than women. That's basically undisputable. And then, and of course, we know the effects of alcohol and chronic complications that they include chronic liver disease and liver cirrhosis. This also increases the mortality rate in men. So as a result of also consuming the alcohol, some men tend to um, drive after being drunk. So of course, that could lead to accidents and so on. And then some are also involved in homicides and suicides. So another factor that was considered is smoking. And I would like to say it's also undisputable that, of course, men smoke more than women. So, and recent studies show that about 75% of the increase in gender gap in mortality in the 20th century was actually as a result of this smoking in men. So so basically, some effects of this smoking include um, formation of some cancers in the body. We know there are some carcinogens that are present in smoke, which we call aromatic amines. So in people that are susceptible, there are people who don't have those enzymes that are able to degrade those aromatic amines. They have high susceptibility to develop cancers, and some of those enzymes include the N-acetyltransferase. So apart from cancers, smoking also increases your chances of developing chronic obstructive pulmonary disease. Of course, that could also lead to death. And It also increases the risk of coming down with cardiovascular disease. Of course, we know that also increases the chances of death. So now, one other factor that was considered was that men are more, they engage in more dangerous jobs and they take bigger risks compared to women. So of course, like things like military combats, it's majorly men that are involved, firefighting, and then even in construction site workers, it's mainly men that are involved. So this also increases the risk of mortality in men. To most men, some studies have also been also shown that men, some men have higher body mass index, as the higher body mass. So this also increases the chances of coming down with cardiovascular diseases and so on. So diet is also another point of consideration. We know that men are more likely to consume red meat, most especially in this part of the world and in other parts of the world too. So also crime rates are also higher for men. So the risk they take and then chances of being exposed to bullets, gunshots, and so on have also. So these are some of the factors that are being considered when considering the lower rates of life expectancy in men. So I think the next question would be, so what can be done? What can be done about all of this? We know
Okay,
that
doctor. Okay,
okay.
thank you. Sorry if I had to just cut you here. So can just have a summary. We have some persons who have just joined us. Welcome, welcome. Today's session we're discussing men's low life expectancy and gender equality. And we have Dr. Peter Otobonge, who is a senior registrar urology division from the University of Uyo Teaching Hospital, giving us some insight into today's theme. He has currently is highlighting why we have the gender gap in um, mortality between men and women. Yeah, most importantly, he stated biological factors whereby the hormones in women, estrogen, protects women against heart disease, and women tend to have stronger immunity compared to men. He also highlighted where you have the frontal lobe of the brain in women is more developed than that of the men, and men being more susceptible to hemophilia, whereby the blood doesn't clot easily. So these are just some of the biological factors he had highlighted, and he further talked about men's attitude towards seeking health care, towards seeking health services, as some of the things earlier. So, doctor, I would like you if you could help us in addressing possibly health challenges men face at different life stages. Before we go into the social determinants, more detailed into the social determinant aspects, as well as what can be done. Can we address it from now, looking at different life stages from boys, adolescents, and what kind of the like things that we should look out for to enable a longer lifespan for men and boys? Thank you.
Okay, thank you very much. Okay, so I would like to start with saying that those are basically sociocultural and behavioral factors. So recent studies show that male neonates, that newborn, are more likely to are less likely to survive the stress of labor and all the perinatal complications compared to females. But they didn't really highlight any reason for that. But studies have actually documented that um, females actually survive the labor stress better than men. So at that stage, so now the so many factors come into play. So it depends on whether it's in a developing country or an underdeveloped country, or in a developed country, because at best the chances of survival will also depend on the health seeking behavior, and then the facilities available. You know, for instance, in developed countries, you basically have everything in place to manage uh, labor and delivery. But in the developing and underdeveloped, there may be one or two challenges here and there. So now coming to the adolescent period, I said that studies showed that the frontal lobe develops faster in females. So, and then that frontal lobe is actually responsible for making somebody to consider the consequences of an action. So, you find out that the boys, adolescent boys, yes, are more likely to be involved in fights, are more likely to be involved in violent behaviors compared to females. Of course, you know that if you put a 10-year-old boy, or let's say a 15-year-old male and 15-year-old female, you tend to find out that in most cases, the females tend to be more matured, more responsible, age for age, compared to the males. So I think so at that point, the behavioral pattern may be responsible for the trend. So then in adults, of course, you find out that more of course more men smoke more than women, they drink alcohol more than women, and then they have these poorer health seeking behavior when compared to the men. So thank you. I think
Okay, thank you very much, Doctor. So we'll come back to you. And I think our next set of questions that will be addressed to you, Doctor, is to look at specific health diseases that are prone to men at these different life stages. I know we really tend to hear about prostate cancer at some stage, and um, I don't know anymore. You're the specialist here, so coming back to you. But now we'll be going to Dr. Steven, who is the health advisor with Plan International. He's going to be discussing with us on the social determinant aspect of it, the entire aspect of gender equality and men's health, men's low life expectancy. We'll be handing the floor over to Dr. Stephen now. Over to you.
Good evening, everyone. This is Dr. Steven. Thank you, Loretta, for the opportunity. Thank you to Girls Power Initiative and NAD for putting this together. So, I know there's a lot of buzz, of course, in terms of what gender equality is, and most people tend to just think of it as a female issue. So, most times when we speak of gender equality, it's always within the context of women's health. But actually, gender issues and gender norms in the sense of how we say it for gender equality actually means that we know societies are structured with rules and beliefs and responsibilities divided between genders depending on the society you are in, and these division tend to uh, have impact on a number of different aspects of our lives, including health. And so usually whatever norms we have, whatever beliefs we have related to gender roles that impacts on health, either positively or negatively, are considered as gender norms, and hence may cause differences between the genders in terms of how the health outcomes are. And so it's common to think of this when we speak of women's health in terms of some beliefs held in some communities. For example, let me say so communities where female sexuality is trying to be curtailed, and then the belief is that women should be curtailed, and then so you begin to have a lot of female genital mutilation, which is something that most people now speak against, and the law is against. And so you find out that this kind of belief hampers on health for women. And what we need to know is that also is that these gender roles that we find related to men also has impact on health. And so what we'll be looking at today is would be what are these expectations in terms of responsibilities and roles of men that and behaviors from society that has a negative impact on health. Of course, there are some with positive impact on health, but then what are the expectations of societies that would have negative impact on the health of the man? And that before coming back to that, also just to bring in what social determinants of health is. We know that we don't live in isolation, and so where in this case we're talking about men, and the man is not in isolation, is impacted by a number of factors around his life. So all of these factors in different layers is what we call social determinants of health. And so there are factors around, of course, within himself, which we've discussed. Dr. Peter has just discussed a number of factors, biological factors, social factors within the man himself. But also there are factors around his family. There are factors around the community which are beyond his immediate control. There are factors within the environment in which he works. There are factors even in the laws and policies governing how he lives his life in the country or the community where he lives. And so all of that together are the social determinants of health. And the idea behind the month, this Men's Awareness Month, is to raise awareness around issues that impact on the health of a man. And so just to speak, there are different frameworks and different, of course, models to think around this. But quite commonly used is the social ecological model, where we look at the man and say, okay, this is the individual here, but he lives within the family. So we look at factors within the individual, which Dr. Peter has done quite a good job in terms of talking about the factors within the individual. I'll just speak a bit also on that. Also, factors within the family. In terms of course, I'll be speaking with in the lens of the gender now, meaning that unique, what are the unique factors to men in this case. Of course, we know a lot of health issues. There are a lot of health issues that affects men and women equally, that affects men and women across board. But I'll be speaking in terms of how gender impacts and the how the belief and the responsibilities attached towards men impacts on their health. The family factors and community factors are also, of course, societal and structural factors. So concerning the individual now, the man, Dr. Peter just mentioned different health. Of course, we speak again on unique health issues, but also mentioned factors within the individual's health, the individual that affects his health. But one important factor I want us to look at or consider quickly is what are the other things that makes that man or men behave this way? What governs the health-seeking behavior? What are the societal issues, gender issues that make men not to be able to in themselves or not to actively seek for help when there's a need for that and the likes. And one of the first factor I will just speak about quickly is that men society generally expects that a man is strong and doesn't show weakness. And so typically, so you find that men, when health issues come up, particularly on mental health, they try to stomach it and stay up and hold it in rather than seek for help. And so what you find out here is that a lot of mental health issues and high suicide rate occurs in men. And just to help us think around this in terms of what are the factors that determines whether a person goes in to seek for help or not, or that makes a person adopt appropriate health behavior. uh just I would love just to use, I'm sure a number of us may be familiar with the health belief model, but just to explain it, that it just says that there are actually a number of factors that will determine whether a person goes ahead to adopt appropriate health behavior in terms of appropriate health behaviors. First, as I'm talking about the individual now, that is, how does the person perceive this health risks to be? Does the person think they are susceptible to the health risk? So we'll speak of unique health condition to men, mental health. Most people will tell you, no, I'm strong, I can't have mental health challenges. And because of that belief, they are, even when they start suffering it, they are unable to go seek for help. Or prostate cancer, most people are not aware that this is an issue and something quite severe. And the next part is, of course, in terms of perceived severity. So even if they think they are susceptible, some people don't know the significance and the impact of this. Sometimes they just say, oh, depression, I'm just sad. It's just sadness. But we know that depression can, of course, go from mild, moderate to severe. And so the perceived severity would help people, men, of course, seek for help. Also, another important part that impacts on health seeking behaviors and health behaviors also is perceived benefits in terms of, even if I go to the hospital, is there any gain to that? If I adopt this health behavior, is there any gain to that? If I speak out and speak to somebody, does it help my mental health? If I seek help from a psychiatrist or mental health psychologist, is there a perceived gain? So if I meet a urologist, does it get better? And so, and this and that builds on and on. So my whole point is this: there are more factors than just that impacts on the health in terms of the individual and the way they think. And of course, what is the family expectation? Does the wife also expect the husband, the man, to be involved in the health of the children, and so, and in that case also take care of his own health? That's family. Community, what do we think around in the community? Are we also, is the community at large open to having men just stroll into the clinic and get screened even when they look healthy, or take time away from work to take care of themselves? Policy, societal level, are there even are there services available? Most men live in communities where they probably have never heard of information around prostate screening and the rest, or are there services that could help uh, adjust the life of men within the community, including physical activities like gym around the facility to keep men healthy? So all of these factors put together are the things that we need to look at critically if we are to address men's health. Thank you. Is there another question you
The questions will keep coming, Dr. Stephen. Thank
okay?
you for that insight. So, what this just tells us that men's health is beyond a man issue. So, for all the men who are listening right now, know that your health status is beyond just your issue. It affects the family, it affects the community, it affects the society at large. And both Dr. Stephen and Dr. Peters has highlighted that most men scare away from accessing healthcare services, from going to health facilities just for a checkup, at least. It- So we're encouraging everyone who is listening to us, and to also spread the gospel to other men around you. Don't shy away from accessing healthcare. I hope maybe when we open this floor up for participants to share their views, the men with us here would be free and will share, possibly if they're in that category, can give us more insight on the reason why they do that. So right now we're going back to Dr. Peters, and we would like to know the specific health challenge that affects men at a particular age group. If so, let's hear from you. I don't so assume right now. Over to you, doctor. Thank you.
Okay, thank you very much, Loretta. So I would just highlight a few because if we start listing them, I think we're going to spend a lot of time. So I'll just highlight a few. Um, let's start with at birth. Like I said earlier, that um I said earlier that there are, for different age groups, there are actually different conditions that can actually impact on the mortality, which is more in men. And I try to attribute them to the Y chromosome and then some X-linked disorders. So basically what I said was that the X-linked disorders are commoner in men, especially if it's the X-linked recessive traits. What that means is that if it's the X-linked recessive, you commonly do not have them in females because the other X chromosome suppresses the effects of these other X chromosomes. So some of the some other developmental disorders, like I mentioned earlier, are also shown to be commoner in men. In urology, I think in pediatric surgery too. There is a condition we call bladder extrophy, where you find out that the front covering of the bladder is exposed to the outside instead of being inside the body. Bladder is the organ that stores urine. So that condition is actually commoner in males, and then it predisposes these boys to bladder cancer. Of course, that can impact on the mortality. So talking about the X-linked disorders, I mentioned the hemophilia earlier. Okay, so it has also been shown that hemophilia is an X-linked disorder that occurs in men. Of course, hemophilia is a bleeding disorder, so they tend to bleed, and then in the process could lead to mortality. There's also a disorder called the Fragile X syndrome. So basically, that really affects the intellectual ability of the males. Sometimes it could actually occur in females, but it's actually rare. So impaired intellectual ability could also impact on the lifestyle, and then which could sometimes even lead to self-harm, and then some other violence related problems. Okay, so there's a condition we call X-linked hydrocephalus. Hydrocephalus is these kids that are born with very large heads, where basically the hydrocephalus, like for the common man, we just say there's water in the brain. So it has been shown to also occur. So hydrocephalus, if not treated on time, if not attended to properly, could actually be a cause of mortality in these children. So looking at the adult life, some of the common diseases that could occur, which are commoner in men, even though the risk is basically environmental. They include chronic liver disease and liver cirrhosis. We know one of the common causes of this is taking in of excess alcohol. So, um, studies have shown that taking more than 21 units a week actually increases your risk of coming down with this chronic liver disease, liver cirrhosis, and liver failure, which we know can also impact on mortality. So, smoking, which is an environmental factor, also predisposes men to more some other deadly diseases like lung cancer. Currently, lung cancer is the commonest cancer in men worldwide. So I think that's followed by prostate cancer. So we know that smoking is a very common risk factor for lung cancer, and then men have been shown to smoke more compared to women. So coming down to the prostate cancer, of course, women don't have a prostate, so we don't expect a woman to come down with prostate cancer. So the basic thing is that every male, as long as you are male, the risk is there, even if it's 0.001%. So every male is at risk of coming down with prostate cancer. So coming down to prostate cancer, there are modifiable risk factors, and then there are non-modifiable. So we discuss the non-modifiable in this context, which includes black race. When prostate cancer has been shown to occur more in blacks, and then age. The higher your age, the higher your chances of coming down with prostate cancer. So we then some other factors include the family history. That's the first degree relatives. So if someone's father has prostate cancer, or someone's brother has, or somebody's son has prostate cancer, it means the chances of this person coming down with prostate cancer it's is also higher. So, but well, would I say good news or the good thing, well, in quotes, about prostate cancer is that the it's not as fatal as the other types of cancers, especially if treated on time. Thank you.
Thank you, doctor. And I like you ended with a good note that prostate cancer is not as deadly and if it's treated on time. Well, this has been very insightful, and I would like to throw the floor open now for anyone who would like to share, or if there was any parts or any questions you have for any of the speakers, either for Dr. Steven or Dr. Peters. This is the time to do so. All you need to do is to request to be a speaker, and you will have the floor. Or you could use a smiley to indicate by raising up your hand. While the floor is left open to us, the month of June is Men's Health Month, which is aimed at raising awareness on men's health, and that is what Girls Power Initiative (GPI) in Nigeria is doing in collaboration with the Nigerian Association of Resident Doctors. It didn't just start today, and so it didn't just start just some few years back. It actually this started in 1992 by a group called the Men's Health Network, and they've used the month of June as an opportunity to raise awareness of preventable health problems in men and to encourage early detection and treatment of diseases in both boys and men. As both speakers had mentioned, we did get to hear that majority of men don't like to access healthcare services. And this made me recall a conversation I was having with someone, a man actually. He complained of backache, and I was like, okay, maybe it was sugar that was causing it, and giving, and it's been, he did said he had to access one of these traditional medicine sellers, and after 3 days, it felt real. It came after taking it felt relieved, and after 3 days, it came back again. And I was like, okay, why don't you just go to the hospital and possibly see a physiotherapist? It was, I don't know, the if it was to me though, for a woman, I think maybe the very first thing was, okay, let me go and see the doctor. Let me know the reason why I'm feeling this way. So if there is any man here who would like to share with us why they might why this is a norm amongst men, is it does it have to do with access, does it have to do with the will I use the funds, or maybe having a HMO, or is it just a man thing? This is your day, and we know that your health goes beyond you, because looking from the gender analysis of it, the role men play in the family speaks a lot. It contributes to the well-being, to the resources in the family. And for many homes who have lost the fatherly personality in the home, we get to see um, there's shrinkage of resources, and many times it's associated with poverty, more difficulty in living, and things like that. So that's why we are trying as much as possible to encourage many men to improve their lifestyles and to access health services. So if there's anyone who would like to share with us, the floor is opened. Okay. In line with that, while we wait, if for anyone who might be interested to discuss, I'll just give us some analysis of research, summary of research that's been done in terms of men's health. The WHO did state in one of their um reports that Approximately 52% of all non-communicable diseases deaths worldwide occurred among men. And we've heard both Dr. Steven and Dr. Peter speak to us about that, and we could see the activities at the individual levels that can result to that. And when we speak of non-communicable diseases, we see risky sexual behaviors, high-risk sports, alcohol consumption, drug abuse, substance uses, reckless behavior, and some leisure activities, risky leisure activities that can lead to that. However, looking at it from the gender perspective, though these vary according to social and cultural context, but it tends to be consistent across various countries in terms of health behaviors that they mentioned earlier, and the masculinity, the gender norm in terms of what it means to be a man. So we see a lot of pressure that are placed on men by family or by social roles, and this might impact their health as there's this belief and expectations about a man's behavior. For example, the man is meant to be the sole provider of family income, and as I'd mentioned earlier, this can exacerbate the lack of economic opportunities and social marginalization. Because when there's so much pressure placed on the man, we could see contributing to his poor health, we could see high BP coming up, and what we term untimely or premature death tends to happen to men at this stage. So in relating to all this, that okay, we have somebody who has requested to speak. Okay, so in relating to all of these, we could say that beyond just at the individual level, we also have the social, cultural aspect of it, and the term I'll tell it masculinity on what it means to be a man. But right now, I'll give this the floor to, I can't pronounce that name, so but you know yourself. Please, over to you.
Okay, yeah, good evening. All you know is Harvey and Alada for John is his name, and John Secretary and Station
Can you kindly speak up, please? I don't know if
Okay.
it's just me, but I can barely hear you.
Okay, can you hear me now? Is it better?
Yes, thank.
Okay. John Oladapo is the name, General Secretary, ARDUCH. It's been nice listening to this space on men's issues, and of course, you've highlighted a few reasons why men tend to seek less help and tend to access care, and that's of course related to the masculine figure, the fact that you're carrying the burden of the family of the burden of the wife, the children, the community, and that again goes to impact the fact that when a man speaks up as regards specific issues, it's assumed that that person is weak, but that's not the case. And a lot of men actually need help, they need care, they need a lot of support, they need to access all of the things that will make them live longer, and not just engage in a lot of risky behaviors. But I think generally, Dr. Steve, my chief from all the way from MENA, has highlighted a whole lot of things. But it's just nice to put in a word. And again, you're looking at the crop of those people that are educated. If you go to the rural areas and to the non-educated persons, you'll be shocked at the level of ignorance and when how it looks like you're weak when you go to access care. So a lot of men only access care when they are very much down and when they cannot really have any other way. So they come in emergency, they come with a lot of complications. And like you mentioned, it has both implications for themselves and for their family, especially as breadwinners of the family. So that's my contribution. Thank you very much for your time.
Thank you. Thank you for the contribution. It was a pleasure hearing from you.
You're welcome.
Okay, so at this juncture, we'll be calling back our speakers, Dr. Stephen and Dr. Peter, starting from Dr. Stephen first. What is your take on addressing this? Because we've gone to see that lots of gender and social norms on what we term as masculinity, as the last speaker had just mentioned, and behavior towards health, and a man being termed weak for speaking up or wanting to attend access health health care. So how do we address this challenge? What can be done? What action can we take, both as individuals or as organizations, as NAD, as Girls Power Initiative, as the society at large? Then to Dr. Peters, it will be from the health perspective, from the medical perspective, what action can we take? Over to you, Dr. Stephen.
All right. So thank you very much. Uh, I would say that we need to think about these issues as health workers, individuals, organizations, as we approach it. And one important aspect will be how we see the issues, which is the idea of this program and the awareness being raised in this month. That we need to first look at the problem as they are across the social determinants of health. That is, we look at the individual, we look at the community, the family, the community in which they live, and we look at the policies and the laws. And only when we get this across board that we are able to make some significant changes. And we need to also come to realize that these are social norms and behavioral norms, and they don't change in a moment. They are usually difficult to change, and it takes time, which means we have to be deliberate about it in terms of how we do our interventions. And so when whether it's an outreach or it's working into the clinic or designing public health interventions, we need to be deliberate about covering the entire spectrum, that is uh, addressing issues with the individual, also looking at the health services. We are not just talking about the men, but are the services being provided also responsive to men? That is, we know men are quite. One of the challenges again is that men working hours are the same hours where the hospitals are open, and so the man has gone to the farm in the rural places. He comes back home, the facility has closed, and so these are thinking that has informed a number of our design and interventions. And another important part I would say is that it's not a standalone issue, so we shouldn't be looking at, of course, just waiting for the month of June or just waiting for having a project and design and say this is a men's project. And so what we do at Plan International is to bring in even most of our projects that are MNCH, SRHR, and are typically gender oriented towards women. There are components that address men's health. And so we usually tailor, one of the things we do is to tailor educational activities for men. So even if we have this curriculum for women to support women in rural community to educate them, we have this behavioral change communication messaging. We also deliberately create for men, and you should address gender issues and gender norms expectation, because again, you cannot help the woman without helping the man. It's a society of both men and women, and so as the women are learning to adjust and pick up more responsibility in terms of trying to earn any living, which again helps the man, because then the man, it reduces the burden of having to be the breadwinner on the man, and so makes allows him to focus on other issues. The same way the man also has to be educated that it is not a threat for a woman to earn a livelihood, and that it also helps the man and also helps the family, because again more resources are available and men are able to seek better help. And so what we do is to uh, tailor educational activities specifically for men and women, even in projects and interventions that are not traditionally focused at men. And also what we do is to engage men and boys in championing the cause of women's rights, in which case they also learn about their own health. And so, for example, across Bauchi and Sokoto, we have what we call Fathers Club. And this was designed in a project with an organization Promudum across 5 countries, for which plan was involved. And so what we have is that across rural communities, we have men discuss women issues and also discuss their own issues. And so are able to better support their wives and also better look at their health. And so just the summary of it is, what do we need to do? We need to be conscious about that it's across several layers, and we don't just focus on the individual, but focus on the other layers that determines the health of the man, and also realize that change comes over time, and try to integrate men's health into other programs that may not be traditionally targeted at men. Thank you.
Yeah, thank you, Dr. Steven. And in summary, some of what you just said is a society for both men and women, and we have to be conscious about it because it's when we are now we gain consciousness, we can begin to drive change. But most importantly, integrate men's health into women's health, not just a standalone for any intervention that is being done. Put them together and see how we can have ripple effects from the interventions we do. Thank you. So over to you, Dr. Peters. From the medical perspective, how can we punch this men's low life expectancy out? Thank you. Over to you.
Okay, thank you very much, Loretta. Okay, so my co-speaker, Dr. Stephen, has already he has done a good job in addressing most of the issues because most of the factors have been shown to be sociocultural and behavioral. I think what I would just like to say is that the approach should be from a multidisciplinary perspective. See, health workers should be involved. You know, community physicians, family physicians, mental health physicians, as well as doctors in other specialties. Part of the problem is ignorance. So when most of these issues are being addressed on a regular basis, it will actually help to improve the health seeking behavior. So I think journalists should also be included. Enlightenment program, which is partly what we are doing now, it's actually part of it. So most enlightenment programs should be carried out on a more regular basis, and then also importantly, I think the government also has a role to play in these issues. Um, Probably that could be a topic for another day. So now, there are basically two aspects to this. There is the non-modifiable factors, which basically you can't do anything about. The biological factors I tried to explain in detail earlier. For instance, females have this estrogen where it has been shown to reduce the circulatory levels of these bad cholesterol, while testosterone has been shown to increase. So there's really nothing you can do about those ones. But for the modifiable aspect, we've seen the harm smoking has done to men, alcohol, and then other basically lifestyle. So I think these measures needs to be taken. So men need to know why they should desist from most of these unhealthy lifestyle. Thank you.
I didn't know I was muted. Okay, thank you, Dr. Steven. Thank you, Dr. Peter. What this has shown is that we shouldn't just wait for the month of June to speak on men's health. It should be an everyday discussion. A lot of enlightenment has to be done. It's multifaceted. You can't just have a one-way approach. We have to see how we can integrate different approaches into making men have more healthy lifestyles and especially accessing health services and also putting the gender perspective into it. That way, I believe it would help in achieving gender equality more because especially when, as Dr. Stephen had mentioned, in terms where we have shared resources in the home, that would also help in the increasing the family well-being and as well giving the woman a sense of empowerment too. And per se, for instance, whatever happens in that home, possibly, uh, yes, we don't like speaking about death, but it's one thing that might happen. There might even be a health crisis. There's another source of income that could be used to support the home. We could There are different positivities towards men having good lifestyles and improving their and consciously trying to improve their health and going for regular checkups. Why the L is going to join us as a speaker, I'd also like to say it's possible why more women tend to access healthcare services because during sexuality education at pubertal stages, we tend to encourage girls and young men that once you have a foul smelling vaginal discharge, or you get to see you have low abdominal pains, especially things in terms of their reproductive system, it's good to access healthcare service. So it's possible why we begin to, well, just as way we have more sexuality education programs for girls and young women, we should try to see how we can extend such sexuality education programs for boys and begin to encourage them in accessing healthcare services. Okay, over to you, Dr. L. I don't know if you're a doctor, but yeah, dressed as a doctor, so that's just I keep saying Dr. Ellis. So over to you, Ellis. And kindly introduce yourself. Thank you.
Okay, thank you so much. Yeah, I was really surprised. I wondered how you knew I was a doctor. Thank you so much. I want to thank you for the program and for putting this in place. My question actually goes to Dr. Steve. Thank you so much for the presentation. I was really enjoying the strategies. I just want to know, as regards the programs that are done for women, like you said, where it's an avenue to also educate men and involve men's health. I want to know the success of the men's attendance, or will I say receptiveness towards such programs, because I know the African man can actually be a very, very difficult person to lure for such programs. And then when the program is now even titled a woman's program, it even makes it more difficult for them to want to be involved in such gatherings. So I would need more light on the success of such programs as regards attendance and receptiveness. Thank you.
Okay, please, Dr. Steven, before you speak, if you'd like to be a speaker, just request to be a speaker, or you do a thumbs up from the smiley. Thank you.
All right. Thank you very much, Dr. Harris. Your profile picture gave you away. You're asking about why we knew you're a doctor. So well, it's fine. The project I referred to was actually called the. Just to mention that it's behavioral change takes a while. So yes, we don't expect that we'll go in and in a month or within a week everybody aligns and then changes. But of course, they are difficult to change and takes time. And so difficult to change means that we have to now think very well about our strategy. So for the project, it was called the Show Project. You can look it up, and it ran across Bangladesh, Ghana, Haiti, Senegal, and Nigeria. And for Nigeria, we implemented that in Bauchi and Sokoto. And actually, what the it ran from 2016 to 2020, and we designed what we had was a manual and technique that was jointly designed by a partner called Promundo, and so it was a well thought out strategy and a series of curriculum where we have Fathers Club, quite a fun gathering in these rural communities to be in, and innovatively bring up these topics to discuss. And so the methodology was quite innovative, because again we know it is a difficult thing to change. And so in 2020 we did the endline qualitative survey, and these are the findings, just to mention, since you wanted to know what the post 5 years is. Husbands and male partners were beginning to take up tasks that have traditionally belonged to women, including household chores such as sweeping, cooking, washing, and childcare. So what we did was to ask these questions at the beginning. We did a survey sampling the community and asked this question, and we established a baseline. And so over the baseline, after 5 years, we found these are the findings. We had increased male engagements around maternity and family health. And so what happens is, as they pick up this positive masculine behavior, it also affects on their health. And the third one is quite important. Men started to consult with their wives before. Okay, this is one. Sorry, started to consult with their wives before taking a decision or making a joint decision. There was improvement, of course, in family relation, and father to child relationship also improved. And also men's health seeking behavior, which is something that relates directly to what I see in addition to all of these findings, were also improved. And adolescent girls and boys reported improved communication and strengthening relationship with their fathers. And so what you find is, after the course of 5 years is when we now went back into remeasure our baseline. So just to mention that, and 5 years will just be the beginning of it for a behavioral change program. And this program isn't just a standalone. This is just a small component of an maternal, neonatal, and child health program in across these 5 countries. So it's actually a project that from the outlook, one would think is targeted towards women. But we know that it's impossible to achieve so much for women without carrying the men along in terms of improving their health outcomes and also gaining their support as champions. And so this is the thinking and the approach that led to that project, and what we believe led to the success. And that methodology is being repeated across other projects across other countries. Was a learning curve at the time and piloted, and we hope that others will also learn and adopt. Thank you.
Well, thank you, Dr. Sevin, for sharing. And I actually like the outcomes, especially the last one you mentioned, whereby boys and girls said they had better relationship with their father. And today being Father's Day, we can see how addressing men's health from a gender perspective can better improve father-children relationship, father-wife, father-mother relationship, and improve the entire family relationship as a whole. So, in this light, I would like to share that it's been a pleasure having you all with us in this session. At the designing of this program, we had three key results we wanted to achieve, with one being increase awareness on Men's Health Month. We hope that by next year, hopefully, we would have more enlightenment, more campaigns driving, addressing issues on men's health, and not just on men's health, but please put it from a gender perspective as well. Then, secondly, to demystify masculinity beliefs that inhibit healthy lifestyle and access to health services. We've seen Dr. Peter, Dr. Stephen, and Dr. Ellis and others share their thoughts on this. Lastly, we also wanted to increase awareness on the importance and tips to nurture men's health. So we've all heard on why it's important for us as men and as supporters of men, as women, girls, to also encourage men to have healthy lifestyles and well-being. It's been a pleasure having you with us. And for those of us who might have not joined earlier, this session is recorded. You can go back to listen to the replay, and I believe it's going to be worth your time. At this juncture, I would be calling the session to an end. And thank you for giving us this time, despite Nigeria is playing Sierra Leone right now. I don't know if the match has ended, but you decided to be here with us till the end. Thank you, and we really appreciate it. And we're rooting for Nigeria to win the match. Thank you, and have a good evening.
Thank you. It's a pleasure.
Thank you very much.